The fluorescent lights blurred as Richard Anderson blinked away tears, their harsh glare stabbing at his eyes. From beyond his curtained bay, he heard chaos erupting in the ER, urgent whispers, a metal tray clattering to the floor, someone retching violently. "Oh my God!" a young voice gasped. "They're moving under his skin!" Richard's trembling fingers reached toward his grotesquely swollen face, but a gloved hand intercepted his wrist. "Don't touch it, Dr. Anderson," Dr. Mitchell warned, his voice steady despite the fear in his eyes. Through the gap in the curtains, Richard glimpsed a young medical resident slump against the wall, sliding to the floor in a dead faint. "What's happening?" he whispered, panic rising as he felt it, a distinct crawling sensation beneath his inflamed skin, like dozens of tiny fingers pushing outward. "Someone get CDC on the line now!" Dr. Mitchell shouted. After 40 years saving others in this very emergency room, would Richard Anderson's medical knowledge save him from the horror living inside his own face? Leave a like and share your thoughts in the comments along with the city you're watching from now. Let's continue with the story. Richard Anderson had never considered himself easily frightened. At 60, he'd spent nearly 4 decades as an emergency room doctor at Memorial Regional, witnessing everything from catastrophic injuries to bizarre medical anomalies. "I've seen it all," he'd often boast to his daughter Sarah. "Nothing gets under my skin anymore." The irony of that statement wasn't lost on him now. 3 years earlier, Richard had watched his wife Margaret fade away, cancer eating her from the inside out over 18 agonizing months. Her medical bills had devoured their retirement savings despite decent insurance, leaving him with a modest pension and a house too large for one person. Sarah had suggested selling it countless times. "Dad, it's too much house, too many memories. You need a fresh start," Sarah would say during their increasingly tense Sunday phone calls. "This house is my life with your mother," Richard would counter, his voice taking on the steel edge that had served him well during chaotic trauma cases, but did little to mend the growing rift with his daughter. Sarah Anderson had followed her father's footsteps into medicine, but chosen surgery instead of emergency medicine. At 32, she was brilliant, driven, and increasingly frustrated by her father's stubborn refusal to move forward. Their conversations had dwindled to obligatory check-ins, punctuated by arguments about Richard's isolation. "You can't just exist, Dad. Mom would want you to live," Sarah had pleaded last month. Something in his daughter's voice had finally broken through. Perhaps it was the echo of Margaret's own words before she died. "Promise me you won't disappear when I'm gone, Rich." A promise he hadn't kept. The Florida trip was Richard's first attempt at fulfilling that promise, a solo vacation to the Everglades, Margaret's favorite spot for birdwatching. They'd planned to go together in retirement. Instead, he went alone, armed with her old Nikon camera and a battered field guide to North American birds. "I'm trying, Maggie," he'd whispered to the empty seat beside him on the flight to Miami. The older woman across the aisle had given him a knowing smile, the universal recognition between widowers. Richard had always prided himself on his medical knowledge and physical resilience. "Immune system of steel," he'd joke with patients. 40 years in the ER builds antibodies to everything." This professional confidence had morphed into a stubborn self-reliance that Sarah found maddening. It was also why Richard had ignored the initial symptoms upon returning from Florida. The small red marks, the persistent itch, the gradually increasing pain. Just bug bites, he told himself, applying over-the-counter creams and taking ibuprofen. His medical experience had taught him most things resolved on their own. By the time he admitted something was seriously wrong, his face had swollen beyond recognition, and the pain had become unbearable. Richard woke at 3:00 a.m. to a pulsing pain radiating across the right side of his face. The Florida vacation had ended 4 days ago, but the cluster of mosquito bites near his temple had grown increasingly irritated. In the harsh bathroom light, he winced at his reflection. The swelling had doubled overnight, stretching from his eye to his jaw. "Just an allergic reaction," he muttered, rummaging through his medicine cabinet. As a former doctor, Richard had accumulated an impressive collection of over-the-counter remedies. He swallowed 2 Benadryl with a handful of ibuprofen and applied hydrocortisone cream to the angry red skin. By morning, his right eye had nearly swollen shut. Richard canceled his weekly poker game with a vague excuse about feeling under the weather. He couldn't bear the thought of his friends seeing him like this, especially Frank, who'd never miss an opportunity to say, "You should get that looked at," in his sing-song voice of concern. When Sarah called for their daily check-in, Richard positioned the phone carefully on his left side, away from the camera. "You're awfully quiet today, Dad," Sarah remarked after carrying the conversation for several minutes. "Just tired. The trip took more out of me than I expected." Sarah paused. "Are you sure that's all? You sound different." "I'm fine," Richard insisted, wincing as a sharp pain shot through his jaw. "Just catching up on laundry and sorting through the photos I took." "Did you use the sunscreen I packed for you? You know how easily you burn." Richard rolled his eyes, a painful mistake as his swollen lid scraped against the socket. "Yes, Doctor. I used SPF 50 and wore the ridiculous floppy hat." After hanging up, Richard swallowed more pain relievers and pressed a cold compress to his face. By evening, the pain had become a constant throb that radiated down his neck. The swelling had hardened, and the skin felt unusually warm. When he pressed gently near his temple, he felt something strange, a slight movement beneath the surface, like bubbles in thick batter. "That's not normal," he whispered, medical alarm bells finally overriding his stubborn self-reliance. At midnight, unable to sleep and with the pain now unbearable, Richard called Sarah. "Dad, what's wrong?" Sarah answered, instantly alert despite the hour. "I think—" Richard hesitated, hating to admit he'd been wrong. "I might need to go to the ER. What's happening?" The rustle of bed sheets came through the phone as Sarah sat up. "My face. There's swelling, bad swelling, and pain." "How long has this been going on?" "A few days since Florida, but it's worse tonight." "A few days?" Sarah's voice rose. "Why didn't you say something earlier? I'm coming over." "No need to—" "I'll be there in 20 minutes. Don't argue." Sarah arrived in 15, still wearing pajama pants under her coat. Her sharp intake of breath when Richard opened the door said everything. "My God, Dad, this isn't just swelling. Your face is twice its normal size." In the car, Richard closed his eyes as waves of pain washed over him. Sarah peppered him with questions about symptoms and timeline, slipping into clinical mode to mask her worry. "Any fever? Nausea? When exactly did this start?" "After that day on the secluded beach," Richard admitted. "I fell asleep for a couple hours, had some bites when I woke up." "Which beach? The one with the warning signs about insect activity?" Richard's silence was answer enough. "Unbelievable," Sarah muttered, accelerating through a yellow light. Memorial Regional's emergency entrance felt eerily familiar to Richard. The same sliding doors he'd walked through thousands of times as a doctor, now from the other side. The waiting room was mercifully empty at 1:00 a.m., and the triage nurse, someone Richard didn't recognize, took one look at his face and immediately ushered them back. "Nancy?" Richard called to an older nurse walking by. The woman turned, confusion crossing her features before recognition dawned. "Richard Anderson? Is that you under all that?" Nancy gestured vaguely toward Richard's face. 20 years together in this ER, and you almost don't recognize me." Richard attempted a smile that turned into a grimace. Nancy squeezed his hand. "I'll get Dr. Mitchell. He's the best on tonight." Dr. Thomas Mitchell was younger than Richard expected, mid-40s, with premature silver at his temples, and kind eyes that couldn't quite hide his concern when he examined Richard's face. "How long has it been like this, Dr. Anderson?" "It's been gradually getting worse for about 4 days," Sarah answered before Richard could downplay it. "He's a retired ER doctor and has been self-treating." "Doctor." Mitchell nodded, gently palpating the swollen area. "Any history of allergies, new medications, foods?" "No," Richard winced. "Just these mosquito bites from Florida that wouldn't heal." "Florida?" His hands paused. "Where exactly? Everglades?" "I was bird watching on a remote beach area." "And the bites, did they look normal initially?" Richard thought back. "They itched more than usual, stayed red longer." Dr. Mitchell leaned closer, using a penlight to examine the swollen skin. His expression changed subtly as he noticed something. There appear to be small, punctate lesions across the swollen area, almost like— He trailed off, pressing gently on the edge of the swelling. Richard gasped as much from the strange sensation as the pain, a distinct movement under the skin, like something shifting position. Dr. Mitchell stepped back abruptly, his professional composure momentarily slipping. "I'd like to get Dr. Winters to take a look. She's our dermatologist on call." While they waited, Sarah held her father's hand, professional demeanor giving way to the concern of a daughter facing her father's suffering. "Why didn't you tell me it was this bad?" "I didn't want to worry you," Richard admitted, "and I thought I could handle it. I've treated thousands of infections, Sarah." "You're not invincible, Dad. No one is." Dr. Amanda Winters arrived 15 minutes later, a tall woman with a clipboard and magnifying lens. Her eyes widened slightly at Richard's appearance, but her voice remained steady. "Dr. Anderson, I understand you're experiencing facial swelling after a trip to Florida. May I examine you?" Under the magnifying lens, Dr. Winters carefully studied the affected area. "I can see several small openings in the skin. They appear to be breathing holes." "Breathing holes?" Sarah echoed. Dr. Winters stepped back, choosing her words carefully. "I believe we may be dealing with a case of cutaneous myiasis, a specific type of tissue infection caused by fly larvae." "Larvae?" Richard whispered, the implications hitting him with full force. "I believe there are parasitic larvae developing beneath your skin, Dr. Anderson. Likely from a species of botfly common in tropical regions." The room fell silent. For all his medical experience, Richard had never faced something living inside him. Sarah's hand tightened around his. "We need to prepare for immediate extraction," Dr. Winters continued, her clinical tone a contrast to the gravity of her words. "I'll contact the CDC for protocol guidance, but we can't wait for their arrival to begin treatment." As Dr. Winters left to make arrangements, Richard caught a glimpse of activity outside his room. Medical staff gathered in small clusters, glancing toward his door with expressions ranging from curiosity to undisguised revulsion. "They're talking about me," he whispered to Sarah. "They're preparing to help you," Sarah corrected, though her eyes tracked the unusual level of commotion in the normally composed ER. When Dr. Mitchell returned, he was accompanied by 2 nurses in enhanced protective gear, far more than standard precautions required. "Is that really necessary?" Richard asked, professional pride stinging. "Standard protocol for parasitic infections of unknown origin," he explained, though they both knew it wasn't entirely true. "We're preparing a treatment room for the extraction procedure." As they wheeled him through the corridor, Richard noticed staff pressing against the walls to give his gurney a wide berth. A young medical resident glanced at his chart, then at his face before suddenly turning pale and excusing himself. The whispers followed him like a wake. "Dozens of them moving under the skin. Never seen anything like it. Called the CDC." For the first time, Richard felt like a spectacle rather than a patient, an oddity to be gawked at rather than a person in need of care. The same halls where he had once commanded respect as a veteran doctor now seemed alien and hostile. The indignity burned almost as much as the pain in his face. The treatment room felt colder than necessary. Richard shivered under the thin hospital gown as Dr. Winters prepared a portable imaging device. The dermatologist worked with methodical precision, her face a mask of professional detachment that didn't quite reach her eyes. "We'll need to do an ultrasound to assess the extent of the infestation," she explained, squeezing gel onto the probe. "Try to remain still." Richard flinched at the word infestation, but kept his expression neutral. Sarah stood nearby, arms crossed tightly across her chest, watching the monitor with the analytical focus she'd developed during surgical residency. The ultrasound image appeared on the screen, a grainy black-and-white landscape of tissue that meant little to most patients, but spoke volumes to medical professionals. Dr. Winters froze the image, her finger tracing several small oval shapes clustered beneath Richard's skin. "There," she said quietly, "multiple larvae. I count at least 30 in this view alone." Sarah leaned closer to the screen, her clinical detachment slipping. "They're much deeper than I expected." Dr. Winters nodded, adjusting the angle of the probe. "That's what concerns me. They're migrating inward rather than creating the typical exit pathway toward the skin surface." The probe moved toward Richard's temple, and Dr. Winters stiffened. "Dr. Mitchell, could you look at this, please?" Dr. Mitchell stepped forward, studying the new image with a deepening frown. Richard couldn't see the screen from his position, but the sudden tension in the room was palpable. "What is it?" he asked, hearing the tremor in his own voice. Sarah answered, her professional tone cracking slightly. "Some of the larvae have migrated dangerously close to your optical nerve pathway." "Meaning, Doctor?" Winters set down the probe, meeting Richard's gaze directly. "If we don't extract them within the next 24 hours, you risk permanent damage to your vision, possibly blindness in your right eye." The room seemed to tilt. In 40 years of medicine, Richard had delivered countless difficult diagnoses to patients, always maintaining that careful balance of honesty and reassurance. Now, on the receiving end, the clinical words struck like physical blows. "We need to move quickly," Dr. Mitchell said, turning to the nurse. "Contact Dr. Patel in ophthalmology and check if CDC has responded to our consultation request." As the medical team dispersed to make arrangements, Richard found himself alone with Sarah. The weight of unspoken accusations hung between them, Sarah's frustration at her father's delayed care, Richard's embarrassment at becoming a medical spectacle. "Did you recognize what they were?" Richard finally asked. "When you first saw my face." Sarah shook her head. "I thought it was an infection. Maybe cellulitis." She trailed off, unable to complete the sentence. "Bugs," Richard said flatly. "Bugs living in my face." The door opened before Sarah could respond. A young nurse Richard didn't recognize entered with an IV tray, stopping abruptly just inside the doorway. "I'm here to start your IV," she said, maintaining a noticeable distance. "You can come closer, honey." "I don't bite," Richard said, attempting humor. The nurse's smile was strained. Dr. Winters requested a broad-spectrum antibiotic and pain management protocol. She moved forward cautiously, her gaze fixed on Richard's unaffected left arm rather than his face. As the nurse prepared the insertion site, Richard caught her stealing glances at the swollen right side of his face. The young woman's hands trembled slightly. "First year nursing?" Richard asked gently. The nurse nodded. 6 months in. I was an ER doctor here for 40 years. Seen just about everything until now, that is." He laughed softly, trying to put the young woman at ease. The nurse's shoulders relaxed slightly. "Everyone's talking about your case." "I bet they are." "Marcy, that's one of the night nurses. She had to take an anti-nausea medication after seeing the ultrasound." The words tumbled out before the nurse could stop herself. Her eyes widened in mortification. I'm so sorry. That was incredibly unprofessional. It's all right, Richard said, though the comment stung. I imagine it's quite the spectacle. After the nurse left, Richard turned to Sarah. Is it really that bad? Sarah hesitated, torn between honesty and comfort. It's unusual. Most staff here have never seen a case like this. But you have? In textbooks during my tropical medicine rotation. Sarah paused. Dad, there's something you should know. The hospital administrator stopped me in the hall. They're concerned about media attention. Richard stared at her. Media attention? Apparently, someone posted something to social media, nothing identifying you, but mentioning a massive bug infestation case in the ER. They're worried about patient privacy and hospital reputation. Wonderful, Richard muttered. I'm a viral sensation before they've even removed the actual parasites. Dr. Mitchell returned with a tablet in hand, his expression grave. We've consulted with CDC and they're sending a specialist. Unfortunately, they can't get someone here until tomorrow morning. Tomorrow? But you said we have 24 hours before risk to your vision increases significantly. Yes. We'll proceed with preliminary treatment now. Dr. Winters is preparing a microsurgical extraction of the larvae closest to the optical nerve, but the CDC has advised against attempting complete removal until their specialist arrives. What about the cost? Richard asked, the practical concern surfacing through his fear. My insurance coverage isn't what it used to be. Dr. Mitchell and Sarah exchanged a glance that Richard immediately recognized, the look medical professionals share when financial realities collide with optimal treatment plans. Let's focus on the immediate medical needs, Dr. Mitchell said diplomatically. Financial services can discuss options later. A knock at the door interrupted them. The hospital administrator, Mr. Bradford, entered with a forced smile that didn't reach his eyes. Dr. Anderson, I wanted to personally check on your care. I understand you're a former employee of our hospital. 40 years, Richard confirmed. Then you understand our commitment to excellence. I want to assure you we're providing the very best care while also respecting your privacy during this unusual situation. The emphasis on privacy wasn't subtle. Richard had seen Bradford deploy this particular brand of corporate concern before, usually when a case threatened potential public relations complications. I'm not planning to call a press conference about the bugs in my face if that's what you're worried about, Richard said dryly. Bradford's smile tightened. We're simply ensuring all staff understand their confidentiality obligations. Now, I understand CDC is sending a specialist tomorrow morning? Dr. Mitchell confirmed. Excellent. We've prepared our best surgical suite. Bradford turned back to Richard. Rest assured, we're treating this with the utmost priority. After Bradford left, Richard let out a humorless laugh. Translation: they're terrified this will damage the hospital's reputation. Can you blame them? Sarah asked. It's not exactly a routine case. No, but it is a case of a human being in pain, something this hospital seems to have momentarily forgotten. Richard shifted uncomfortably, the movement triggering a wave of nausea as he felt distinct movement beneath his skin. God, I can feel them moving. Sarah squeezed his hand. The pain medication should be helping soon. It's not just the pain, it's... Richard struggled to articulate the unique horror of his situation. It's knowing they're in there, living, moving. The door opened again as Dr. Winters returned with a surgical tray. We're ready to begin the preliminary procedure, Dr. Anderson. We'll be extracting only the larvae posing immediate risk to your optical nerve pathway. A nurse followed with a consent form which Richard signed with a trembling hand. Years of witnessing patients in this exact position hadn't prepared him for the vulnerability he now felt, the complete surrender of control to others. Will I be awake? He asked. Local anesthesia with conscious sedation, Dr. Winters explained. We need you responsive in case the larvae migrate during extraction. As they prepared to move him to the procedural suite, Richard caught sight of his reflection in the darkened computer screen, his face distorted beyond recognition, the right side grotesquely swollen. For the first time, he fully comprehended why the hospital staff had reacted with such revulsion. In the hallway, a group of staff members clustered at the nurse's station fell silent as Richard's gurney approached. He recognized several former colleagues among them, their expressions a mix of morbid curiosity and discomfort. One, Karen from pediatrics, actually took a step back as the gurney passed. 20 years working side by side, and now she can't stand to be near me, Richard whispered to Sarah. They're just shocked, Dad. It's not personal. It feels pretty damn personal from this side of the gurney. As he was wheeled into the procedural suite, Richard noticed a young resident in the observation area holding up his phone, subtly angling it toward the gurney. Sarah followed his gaze and immediately strode over, her face thunderous. "What do you think you're doing?" Her voice carried across the room. The resident lowered his phone, flushing. "I was just checking messages." "No, you weren't. Delete that, now. And consider yourself reported to the Ethics Committee." Sarah's tone left no room for argument. "Dr. Anderson, is there a problem?" Dr. Winters asked as she entered the suite. "My father's condition is not an Instagram opportunity," Sarah said coldly, returning to Richard's side. In the bright lights of the procedural suite, surrounded by sterile blue drapes, Richard felt utterly exposed. Being on the table rather than beside it highlighted how completely his identity had shifted from respected caregiver to spectacle, from medical professional to medical curiosity. As the sedation began to take effect, Richard heard Dr. Winters explaining the procedure to someone new who had entered the room. "We'll extract only the specimens threatening the optical nerve path. Full removal will wait for CDC protocol tomorrow." "Has anyone contacted ophthalmology?" the new voice asked. "Dr. Patel is on his way. The concern is that larval migration during extraction could cause pressure on the nerve." The clinical discussion of his condition, as if he were a case study rather than a person, was the last thing Richard heard before the sedation pulled him into a merciful haze. His last conscious thought was wondering if he'd treated his own patients this way, discussing their conditions over their sedated bodies, reducing them to interesting medical puzzles rather than people experiencing the worst day of their lives. Richard drifted back to consciousness in stages, the antiseptic smell of the recovery room bringing decades of professional memories before his personal situation reasserted itself. His face throbbed beneath layers of bandages. Through half-open eyes, he saw Sarah sitting beside the bed, scrolling through something on her phone with a furrowed brow. "How bad was it?" Richard's voice came out raspy. Sarah startled, then leaned forward. "Hey, you're awake." She squeezed Richard's hand. "Dr. Winters successfully removed 7 larvae that were dangerously close to your optical nerve. The procedure went well." 7 out of how many?" Sarah hesitated. "The ultrasound showed approximately 40 to 50 total." She glanced at the door before continuing quietly. "But the extraction revealed there are likely more. Dr. Winters is concerned we're dealing with multiple clusters at different developmental stages." Richard closed his eyes, fighting a wave of nausea. "When will they remove the rest?" "The CDC specialist arrives at 6 tomorrow morning. Dr. Campbell, he's their parasitology expert. They want to document the case fully." "Lucky me," Richard muttered. "I've become a medical oddity in my own hospital." "You're not an oddity, Dad. You're a patient with a rare tropical parasite infection. It's medically significant." "Is that why 2 nurses were filming the procedure on their phones?" Sarah's expression hardened. "What? Who?" I was sedated, not unconscious. I saw them behind Dr. Winters. Sarah stood abruptly. I'll speak to administration immediately. That's completely unethical and against hospital policy. Don't bother. Just get me out of here once these things are gone. Richard shifted uncomfortably. Have you called your supervisor about missing work? It's handled, Sarah said dismissively. My patients were reassigned. You can't jeopardize your surgical residency for this, Sarah. I'll be fine. You have potentially dangerous parasites near your brain, Dad. I'm exactly where I need to be. Before Richard could argue further, Dr. Mitchell entered with a tablet in hand. His expression was professionally neutral, but Richard recognized the look of someone carrying unwelcome news. Dr. Anderson, how are you feeling after the procedure? Like I have dozens of parasites still crawling under my skin, Richard replied dryly. Otherwise, just peachy. He nodded, acknowledging Richard's gallows humor. The preliminary procedure went well, but we'll need to wait for the CDC specialist before proceeding with complete extraction. In the meantime, we've started you on an antiparasitic medication that should help weaken the larvae. And the ones near my eye? Successfully removed. Dr. Winters created a detailed map of the remaining larval pockets for tomorrow's procedure. He hesitated. There is one additional concern. The preliminary blood work shows elevated inflammatory markers suggesting your body is mounting a significant immune response. We're adding corticosteroids to your treatment to reduce inflammation. You're worried about anaphylaxis if the larvae rupture, Richard translated, his doctor's mind automatically processing the clinical implications. It's a precautionary measure, Dr. Mitchell confirmed. We'll be monitoring you closely overnight. After he left, Sarah resumed her seat. You should rest, Dad. Hard to rest when you know there are things living inside you. Richard stared at the ceiling. I keep thinking about all the patients I've treated. Did I ever make them feel like a specimen instead of a person the way I feel now? You were a good doctor. But was I a compassionate one? Richard turned to his daughter. I remember a case years ago. A homeless man came in with maggots in a wound on his leg. The staff treated him like he was disgusting. I was professional, did my job, but did I really see him or just the medical problem? Sarah didn't answer immediately. Medicine requires some emotional distance, she finally said. There's distance, and then there's dehumanization. I'm getting a crash course in the difference. Richard gestured toward the hallway where shadows of hospital staff occasionally paused near his door before moving on. I can feel them out there, stealing glances, whispering. As if on cue, the door opened slightly, and two young faces, medical students by the look of them, peered in before quickly disappearing. See? Richard said. I'm the freak show now. I'll speak to someone, Sarah began, but Richard waved her off. It won't help. Human nature is what it is. I've been in medicine long enough to know that rare cases attract attention. I just never thought I'd be one. The night progressed slowly. Sarah eventually dozed in the recliner while Richard remained awake, hyper-aware of every sensation in his face. Each tiny movement beneath his skin sent fresh waves of revulsion through him. The pain medication dulled the physical discomfort, but did nothing for the psychological horror. Around 3:00 a.m., a nurse Richard didn't recognize entered to check his vital signs. Can't sleep? The nurse asked sympathetically. Would you with these things inside you? Richard responded. The nurse, her badge read Diana, adjusted the IV drip. I've been a nurse for 27 years, and I've never seen anything quite like your case. Lucky me. Actually, I meant you're handling it remarkably well. Most patients would be hysterical. Richard gave a humorless laugh. 40 years in the ER builds a high tolerance for horror. Though I'm finding it's different when you're the patient. Diana nodded, understanding in her eyes. It always is. I had kidney stones last year. Felt like a complete novice despite having treated hundreds of cases. For the first time since admission, Richard felt a genuine human connection, doctor to nurse, beyond the spectacle of his condition. "The staff reaction?" Richard began, hesitantly. "Has it been as bad as it seems?" Diana considered the question. "It's been unusual. 2 nurses requested reassignment. The young medical student who fainted, Jason, he's taking some ribbing for that, but mostly it's just the novelty. No one means any harm. Except the ones filming the procedure on their phones." Diana's expression darkened. "That's been addressed. Those nurses have been suspended pending review." After Diana left, Richard finally drifted into uneasy sleep, only to be awakened shortly after dawn by increased activity in the hallway. Sarah was already awake, freshly changed into clothes Richard didn't recognize. "Did you go home?" Richard asked groggily. "Just briefly to shower and grab some things for both of us." Sarah placed a small duffel bag on the bedside chair. "The CDC team arrived early." Dr. Winters entered with 2 unfamiliar men in professional attire, one middle-aged with salt and pepper hair, the other younger with rimless glasses. "Dr. Anderson, this is Dr. Campbell from the CDC's Division of Parasitic Diseases, and Dr. Lewis, who specializes in tropical medicine." Dr. Campbell stepped forward with a surprisingly warm smile. "Dr. Anderson, thank you for your patience. I understand this has been an extremely distressing experience." His simple acknowledgement of Richard's humanity rather than just his condition nearly brought tears to Richard's eyes. "We'd like to examine you and review the images before discussing the extraction procedure," Dr. Lewis added, "with your permission." The examination was thorough but conducted with a respect Richard had found lacking in some of the hospital staff. Dr. Campbell spoke to him directly throughout, explaining what they were seeing and finding. "These appear to be human botfly larvae, Dermatobia hominis, common in tropical regions," he explained. "The female botfly captures a mosquito or tick, attaches her eggs to it, then releases it. When the carrier bites a human, the eggs are transferred to the skin and hatch from the body heat." "So I didn't get them directly from the botfly?" Richard asked. "No. Likely from mosquito bites during your Florida trip. The Everglades region has seen increased reports of tropical parasites in recent years, possibly related to climate change expanding their habitat northward." Dr. Lewis studied the ultrasound images with interest. "What's unusual in your case is the deep migration pattern. Typically, these larvae create breathing holes toward the skin surface. Yours have burrowed deeper, creating a more complex extraction challenge." After their examination, the doctors stepped outside to consult with Dr. Winters and Dr. Mitchell. Sarah followed them, leaving Richard momentarily alone. Through the partially open door, he could hear fragments of their discussion. Multiple clusters requiring staged extraction. Ophthalmic involvement necessitates specialized approach. Unusual migration pattern suggests possible hybrid species. Richard closed his eyes, trying to tune out the clinical dissection of his condition. He had participated in thousands of similar conversations as a doctor, never fully appreciating how it felt to be the subject of such discussions, reduced to an interesting collection of symptoms rather than a person experiencing fear and pain. When the door opened again, the entire medical team entered, accompanied by Mr. Bradford, the hospital administrator. "Dr. Anderson?" Dr. Campbell began. "We've developed a treatment plan. The extraction will need to be performed in stages due to the number and location of the larvae. The first procedure will focus on the clusters near sensitive facial structures, the remaining optical nerve pathways, facial nerves, and sinuses." Dr. Winters continued, "We'll use microsurgical techniques with real-time imaging to track larval movement during extraction. This is crucial since movement can be stimulated by the procedure itself." "And the risks?" Richard asked, meeting each doctor's eyes in turn. "Primary risks include nerve damage, infection, and inflammatory response," Dr. Lewis explained. There's also a small risk of anaphylaxis if larval contents are released into surrounding tissue. Given the proximity to critical structures, we'd normally perform this at a specialized tropical medicine center, Dr. Campbell added. But immediate treatment is necessary, so we'll adapt resources here. Mr. Bradford cleared his throat. We've arranged for our most advanced surgical suite and imaging equipment. Memorial Regional is committed to providing exceptional care in this unusual circumstance. Will I be conscious during the procedure? Richard asked. The doctors exchanged glances. We recommend general anesthesia, Dr. Mitchell said. The procedure will be lengthy, potentially 5 to 6 hours, and psychologically challenging to endure while conscious. As the medical team discussed technical details, Richard caught fragments that heightened his anxiety. Potential ocular involvement, cranial extension concerns, staged approach necessary. The clinical terminology couldn't disguise the essential message. His condition was more serious and complex than initially believed. When the doctor stepped out to prepare for surgery, Mr. Bradford lingered behind. Dr. Anderson, there's a financial matter we should discuss. His tone was carefully neutral. This procedure involves specialized equipment and expertise beyond standard care. Your insurance coverage may not fully... Are you seriously discussing billing while he has parasites near his brain? Sarah interrupted, returning from the hallway conversation with the doctors. Bradford maintained his professional demeanor. It's hospital policy to address financial considerations before non-emergency procedures. We can discuss payment plans and hardship applications. My father worked at this hospital for 40 years, Sarah said coldly. And you're worried about payment while he's suffering. Sarah, it's okay, Richard intervened, too exhausted to watch his daughter fight this battle. Mr. Bradford is just doing his job. He turned to the administrator. Send the paperwork. I'll figure it out later. After Bradford left, Sarah paced the small room. Unbelievable. Absolutely unbelievable. It's how the system works. You know that. Doesn't make it right. Sarah stopped pacing. Dad, there's something I need to tell you about the surgery. Richard tensed. What is it? Dr. Winters asked me to assist in the procedure. You? Why? Sarah hesitated. Because of my fellowship training. The rotation I did last year at Emory's Tropical Medicine Institute, I have experience with parasitic extraction techniques. Richard stared at his daughter, information slotting into place. The tropical medicine rotation you insisted on taking, even though it didn't align with your surgical specialty. You never explained why. It's a growing field. I thought it would be valuable. Sarah. His daughter sighed, sitting on the edge of the bed. Fine. Remember that medical mission trip to Honduras during my second year of med school? We treated several cases of myiasis, similar to yours, but less severe. It was fascinating from a medical perspective, but devastating for the patients. Their fear, their sense of violation, she paused. I wanted to help people like that, so I did the rotation. For the first time, Richard saw his daughter's career choices in a new light. Not just ambition driving her, but genuine compassion. So, you'll be in the operating room? Sarah nodded. As part of the extraction team. Is that okay with you? Richard considered the strange role reversal, his daughter participating in such an intimate and vulnerable moment of his life. Will it affect your objectivity, operating on your father? I'm a surgeon, Dad. I can compartmentalize. Sarah's professional mask slipped slightly. But I want to be there. I need to be there. The pre-operative preparations began shortly afterward. Consent forms, anesthesia consultation, final imaging. Through it all, Richard observed the subtle shifts in how different staff members approached him. Some with clinical detachment that bordered on avoidance, others with manufactured cheerfulness that rang false, and a few with genuine compassion that acknowledged both his medical condition and his humanity. As they prepared to transport him to surgery, Richard caught Sarah's hand. "Whatever happens in there, thank you for being here. Not just as a doctor, but as my daughter." Sarah squeezed his hand in return, her professional composure momentarily giving way to the vulnerability of a daughter facing her father's suffering. "Always, Dad. Always." The surgical suite buzzed with controlled tension as staff positioned equipment around the operating table. Richard lay conscious but sedated, aware of the methodical preparations taking place around him. A surgical drape created a tent-like barrier at his neck, separating his awareness from the battlefield his face had become. Dr. Winters stood at the head of the table, reviewing final imaging scans with Dr. Campbell from the CDC. Dr. Lewis was adjusting the microsurgical equipment while Sarah, now unrecognizable in full surgical attire, arranged instruments on a stainless steel tray. "Dr. Anderson, we're going to begin anesthesia now," the anesthesiologist said, adjusting something in Richard's IV line. "Count backward from 10 for me." 10, 9, 8. Richard's voice grew distant to his own ears as the medication took effect. His last conscious thought was wondering if he would look like himself again when he woke up. The surgical team watched as Richard's eyes closed and his breathing steadied under anesthesia. "Vitals stable," the anesthesiologist confirmed. "We're ready to proceed." Dr. Winters nodded to the team. "Let's begin with the peripheral clusters before approaching the optical nerve pathway. Dr. Anderson, you'll assist with retraction while I make the initial incisions." Sarah stepped forward, fully in her professional role despite the patient being her father. "Yes, doctor." Dr. Campbell positioned himself across from Dr. Winters. "I'll document each extraction for CDC records. These specimens are valuable for our research on northward migration of tropical parasites." Dr. Winters made the first careful incision along the outer boundary of the swelling. "Remarkable how the larvae have created an interconnected network rather than isolated pockets. I've never seen this pattern before." As the outer layer of skin was retracted, the team fell momentarily silent at the site beneath. Dozens of cream-colored larvae, each about the size of a small bean, nestled in separate chambers throughout the subcutaneous tissue. Several wiggled in response to the sudden exposure. "Initial visual assessment suggests at least 60 larvae," Dr. Lewis noted, his voice clinical despite the disturbing sight. "Multiple developmental stages present." Sarah maintained her professional composure, though her hands trembled almost imperceptibly as she held the retractor. These weren't just specimens, they were invaders in her father's body. "Beginning extraction of first cluster," Dr. Winters announced. "Approaching with microforceps, careful not to rupture the larvae. Intact removal reduces risk of inflammatory response." For the next hour, the team worked methodically, extracting larvae one by one, dropping each into labeled specimen containers. The parasites had created an intricate network of tunnels throughout Richard's facial tissue, requiring delicate navigation to avoid nerve damage. "These tunnels are remarkably structured," Dr. Campbell observed, "almost as if they're communicating with each other, coordinating their feeding and growth patterns." "Approaching the infraorbital nerve," Dr. Winters warned, as they reached a particularly delicate area. "Extreme caution needed here." Sarah adjusted her position, providing better visualization as Dr. Winters carefully separated a larvae that had wrapped itself around the nerve bundle. "Pulse is elevating," the anesthesiologist reported, "blood pressure rising slightly." "His body's responding to the manipulation," Dr. Lewis suggested. "Let's pause briefly." As they waited for Richard's vitals to stabilize, Dr. Campbell examined the specimens already collected. Multiple stages of development present. Fascinating. This suggests he was exposed to eggs on several occasions, not just a single event. "Is that common?" Sarah asked, momentarily breaking her focused silence. "Not typically. Usually we see clusters from a single egg-laying event. This pattern suggests repeated exposure over several days." The surgery continued, moving systematically through the mapped clusters. 2 hours in, they had removed 37 larvae, but the most challenging extraction still lay ahead, those nearest to the optical nerve pathway and those that had tunneled deepest into the tissue. "Beginning approach to periorbital cluster," Dr. Winters announced. "Dr. Anderson, I'll need the finer forceps and maximum magnification." Sarah handed over the instruments, her eyes fixed on the monitor showing the magnified view of the tissue surrounding her father's eye. A cluster of 5 larvae had nestled dangerously close to the optic nerve, their feeding activity already causing inflammation in surrounding tissues. "These are the ones posing the greatest risk to his vision," Dr. Winters explained. "Their position suggests they're actively feeding on the fatty tissue surrounding the nerve bundle." As Dr. Winters carefully positioned the forceps around the first larvae, an unexpected movement sent a ripple of tension through the team. "It's retreating deeper," Dr. Lewis observed. Responding to the stimulation, they sense the disturbance. "This defensive behavior is typical when they feel threatened," Dr. Campbell confirmed. Dr. Winters paused, reassessing her approach. "We need to block their retreat path before attempting extraction." "Dr. Anderson, can you position the secondary retractor at the inferior margin?" Sarah complied, her surgical training taking precedence over the emotional reality that this was her father's face being invaded. "Retractor positioned." With the retreat path blocked, Dr. Winters again attempted to grasp the larvae. This time she succeeded, slowly extracting the writhing parasite from its nestled position. "First periorbital specimen secured," she announced with quiet satisfaction. "4 more in this cluster." As they continued working, Dr. Morris, the chief of surgery, entered the operating room to observe. His presence was unusual for a procedure already staffed with specialists, signaling the exceptional nature of the case. "How's it progressing?" he asked, maintaining a respectful distance from the sterile field. "We've removed 42 specimens so far," Dr. Winters reported without looking up from her work. "Approximately 20 to 30 remain, including the most complexly positioned ones." Dr. Morris nodded, studying the monitors. "Hospital administration is receiving media inquiries. Nothing identifying the patient, but word has spread about a major parasitic infection case." Sarah's head snapped up. "How did that happen?" "Small hospital, big news," Dr. Morris replied simply. "We're maintaining complete confidentiality, of course." The surgery continued for another hour, the team working through increasingly challenging extractions. The larvae near Richard's sinuses had created an elaborate network of tunnels requiring careful navigation to avoid damaging sensitive structures. Approaching the 4th hour, the anesthesiologist reminded them blood pressure remains elevated but stable. Dr. Winters paused, flexing her fingers to combat fatigue from the precise microsurgery. "Let's reassess our progress." The imaging showed they had successfully removed 58 larvae with approximately 15 remaining in the deepest tissues. These final specimens presented the greatest challenge. They had burrowed into areas with limited access and high risk of collateral damage. "I recommend a staged approach for the remaining larvae," Dr. Campbell suggested. "Remove those with clearest access paths today, then reassess for a second procedure after 48 hours of antiparasitic medication." Dr. Winters considered this, looking to Sarah for input. "Dr. Anderson, your thoughts?" "The remaining larvae are in highly complex positions." Sarah studied the imaging, acutely aware that her professional judgment and personal concerns were colliding. "The deepest specimens near the facial nerve present significant extraction risks." "I agree with Dr. Campbell." Targeted extraction of accessible specimens today, followed by medication to weaken the remaining larvae for a second procedure. That's my assessment as well, Dr. Winters confirmed. Let's proceed with the accessible remaining specimens. As they returned to work, the anesthesiologist reported a concerning change. Blood pressure spiking, 160/95, heart rate increasing. Dr. Lewis checked the surgical field. Any signs of anaphylaxis or inflammatory response? Localized inflammation increasing around the current extraction site, Sarah noted, pointing to the reddening tissue visible on the monitor. One of the larvae may have ruptured, Dr. Campbell suggested, examining the area more closely. Yes, there's larval fluid leaking into the surrounding tissue. Dr. Winters acted quickly. Irrigation with antiparasitic solution. Push 100 milligrams hydrocortisone IV to counteract inflammatory response. The team worked efficiently through the crisis, bringing Richard's vital signs back to acceptable levels while continuing to address the contaminated tissue. The inflammatory response is subsiding, the anesthesiologist reported after several tense minutes. Vitals stabilizing. Sarah released a breath she hadn't realized she was holding. The clinical part of her brain had maintained focus during the crisis, but her daughter's heart had raced with fear. We'll need to be even more cautious with the remaining extractions, Dr. Winters noted. The tissue is now hypersensitive. For the next hour, they continued removing the accessible larvae with redoubled care. By the 5th hour of surgery, they had successfully extracted 67 specimens, leaving only 6 in positions deemed too risky for immediate removal. I believe we've reached the appropriate stopping point, Doctor, Winters announced, stepping back from the table. The remaining larvae are isolated in areas where extraction risks outweigh immediate benefits. We'll initiate aggressive antiparasitic therapy and reassess in 48 hours. I concur, Dr. Campbell said, reviewing the final imaging. The remaining specimens can be addressed in a second procedure after medication has weakened them and reduced their movement. As they began closing the multiple small incisions, Dr. Lewis turned to Sarah. Dr. Anderson, your microsurgical assistance was invaluable. Your steady hand with those periorbital extractions likely saved your father's vision. Sarah nodded, emotion finally breaking through her professional veneer now that the critical work was complete. Thank you, but it was a team effort. Dr. Winters finished the final suture and stepped back, removing her surgical mask with a deep exhale. Remarkable case. I've never seen such an extensive myiasis infection with this migration pattern. We'll need to identify exactly which species we're dealing with, Dr. Campbell added, looking at the containers of extracted larvae. Some appear to be standard Dermatobia hominis, but others show unusual characteristics. As the team began post-operative protocols, Mr. Bradford appeared in the observation area, gesturing for Dr. Morris to join him. Their hushed conversation, though inaudible, clearly concerned hospital administration matters rather than patient care. Sarah remained by her father's side as preparations were made to transfer him to recovery. Despite her exhaustion after the marathon procedure, she insisted on staying with Richard through the transition. He's likely to experience significant post-operative pain and possibly confusion, the anesthesiologist warned as they prepared for Richard to regain consciousness. The tissue trauma is extensive. Sarah nodded, mentally preparing for her father's recovery while processing what she had just witnessed and participated in. The surgery had been simultaneously a professional triumph and a profoundly disturbing experience. Seeing her father's face invaded by parasites, participating in their extraction, knowing that some still remained. As they wheeled Richard toward recovery, Dr. Winters fell into step beside Sarah. You maintained remarkable composure throughout, she said quietly. It can't have been easy operating on your own father. I compartmentalized, Sarah replied, echoing what she had told Richard before surgery. "It's what we're trained to do. Even so, your assistance today was exceptional." Dr. Winters paused. "I understand your fellowship application is being considered by Boston General." Sarah looked up in surprise. "Yes, that's right. Their parasitic disease unit is one of the best in the country. After today's demonstration of your skills, I'd be happy to make a call on your behalf." Before Sarah could respond, they reached the recovery area where the priority immediately shifted back to Richard's care. As the transfer team moved her father to the recovery bed, Sarah caught sight of Richard's face, still swollen but now clean of parasites, sutured neatly where extractions had occurred. "When will he wake up?" Sarah asked. "Should be within the next 30 minutes, the anesthesiologist replied. "We'll monitor him closely for any signs of inflammatory response or neurological issues." Sarah pulled a chair beside her father's bed, finally allowing the weight of the day to settle on her shoulders. For hours, she had been Dr. Anderson, surgeon. Now, alone with her unconscious father in the dimly lit recovery room, she was simply Sarah, a daughter watching her formidable father rendered vulnerable by circumstances neither of them could have imagined. She gently touched Richard's hand, careful to avoid disturbing the IV. "We got most of them, Dad," she whispered. "You're going to be okay." As if in response, Richard's fingers twitched slightly beneath Sarah's. The monitor showed his heart rate increasing as he began the journey back to consciousness. Dr. Campbell appeared at the doorway. "Dr. Anderson, a moment." Sarah reluctantly stepped away from the bedside. "Yes?" "Initial examination of the specimens has revealed something unexpected." He showed her a tablet with microscope images of the extracted larvae. "These aren't all the same species. We're seeing at least 2 distinct types, possibly 3. What does that mean for my father's treatment?" "It means we need to adjust our anti-parasitic approach to target multiple species. Also, the migration pattern makes more sense now. Different species establishing different pathways through the tissue." Sarah processed this information with growing concern. "Will this complicate the second procedure?" "Potentially. I've already contacted our lab for rapid species identification and targeted treatment recommendations." He hesitated. "There's something else. The hospital administrator is concerned about potential media coverage. Apparently, rumors about the case have reached local news outlets." Sarah's expression hardened. "My father's medical condition is not a public spectacle." "Of course not. But cases like this have scientific significance." "The CDC would typically publish findings, anonymized, naturally." "That's for my father to decide when he's recovered," Sarah said firmly. "For now, complete confidentiality is the priority." Dr. Campbell nodded in agreement. "Absolutely. I'll ensure our team understands that." As he left, Sarah returned to her father's bedside just as Richard began showing signs of waking. His eyelids fluttered, and a small moan escaped his lips. "Dad, can you hear me? The surgery is over." Richard's eyes opened slowly, unfocused at first, then finding Sarah's face. "Sarah?" His voice was hoarse from the breathing tube. "I'm here, Dad. Everything went well." Richard's hand moved to his face but stopped before touching the bandages. "Did you get them all?" Sarah hesitated, deciding honesty was necessary. "We removed 67 larvae. There are 6 remaining in positions too risky for immediate extraction. We'll treat with medication and remove them in a second procedure." Richard closed his eyes briefly, absorbing this information. "I can still feel them," he whispered. "Moving." "That's likely tissue swelling and nerve sensitivity," Sarah explained gently, though she couldn't be certain. "The anti-parasitic medication will start affecting the remaining larvae soon." The recovery room door opened as Dr. Winters entered to check on her patient. "Dr. Anderson, welcome back. How are you feeling?" Like my face has been invaded by aliens and then surgically excavated, Richard replied with unexpected dry humor. So, exactly as expected. Dr. Winters smiled, pleased by Richard's lucidity and spirit. The surgery went very well. Your daughter was instrumental in the success of the procedure. Richard's eyes moved to Sarah. You actually operated on your own father. I assisted, Sarah corrected. Dr. Winters did the heavy lifting. Your daughter is being modest, Doctor. Winters countered. Her microsurgical skills were exceptional, particularly with the periorbital extractions. Those were the ones threatening your vision. A mixture of emotions crossed Richard's face, pride in his daughter's abilities, discomfort at being the recipient of those skills, and lingering horror at his condition. What happens now? He asked. We'll monitor you closely overnight, Dr. Winters explained. Tomorrow, we'll begin aggressive anti-parasitic therapy to weaken the remaining larvae. In approximately 48 hours, we'll perform a second, smaller procedure to remove them. Richard nodded slowly, then winced at the movement. And the media circus I've been hearing about from the staff? Dr. Winters and Sarah exchanged glances. There's been some interest in your case, Dr. Winters acknowledged, but your privacy is our priority. I spent 40 years in this hospital. I know how these things work. Richard's voice strengthened despite his weakened state. Rare cases become teaching moments, conference presentations, journal articles. I just want to know what I'm facing. That would be entirely your decision, Dr. Winters assured him. Nothing will be shared without your explicit consent. As Dr. Winters completed her assessment and left, Richard turned to Sarah. Be honest with me. How bad was it in there? Sarah considered how to respond, balancing medical honesty with compassionate restraint. It was extensive. The larvae had created complex tunnel networks throughout the tissue, but the extractions were successful and there's no evidence of permanent structural damage. And you? How was it for you? Operating on your father? Sarah sat on the edge of the bed, finally allowing her professional mask to slip completely. Hardest thing I've ever done. I kept switching between seeing you as my father and seeing you as a patient, but when it really mattered, training took over. Richard reached for his daughter's hand. I'm proud of you, even if I never wanted to be your patient. The moment of connection was interrupted as the recovery room door opened again. This time it was Mr. Bradford, the hospital administrator, looking uncommonly serious. Dr. Anderson, he began, addressing both father and daughter. I hope I'm not intruding. I wanted to check on Dr. Anderson's recovery and discuss a sensitive matter. Can't it wait? Sarah asked, irritation evident in her voice. My father just woke up from major surgery. Unfortunately, it cannot. Bradford stepped closer, lowering his voice. A local news outlet has contacted the hospital requesting information about, and I quote, the patient with bugs living in his face. They claim to have received tips from multiple sources within the hospital. Richard closed his eyes briefly. Wonderful. We've issued a standard no-comment response regarding any specific patient, Bradford continued. But given the unusual nature of this case and Dr. Anderson's long history with our hospital, I wanted to discuss options. Options? Sarah repeated skeptically. The CDC considers this case scientifically significant. There's potential benefit to the medical community in documenting and sharing findings. Additionally, proper public education about tropical parasites could prevent similar cases. Richard studied Bradford's carefully neutral expression. You're worried about the hospital's reputation if this leaks in an uncontrolled way. Bradford didn't deny it. We prefer to manage sensitive situations proactively. So what exactly are you proposing? Sarah demanded. A controlled release of general information about the case, no identifying details, along with educational content about prevention. CDC would participate in the messaging. Before Sarah could object, Richard raised his hand weakly. "I'll consider it after the second procedure." "When all these things are out of me, not before." Bradford nodded, seemingly satisfied with this compromise. "Of course, focus on your recovery, Dr. Anderson. We can discuss details later." After he left, Sarah turned to her father in disbelief. "You're actually considering it? Letting them turn this into a public spectacle?" "If it prevents someone else from going through this, maybe." Richard adjusted his position carefully, grimacing at the pain. "Besides, I spent my career helping people. If my humiliation serves some greater medical purpose, so be it." Sarah watched her father with newfound respect. Despite everything Richard had endured, the physical invasion, the pain, the loss of dignity, he was still thinking like a healthcare provider, still placing others' needs in the equation. "You should rest," Sarah said gently. "I'll be right here." As Richard drifted into medicated sleep, Sarah remained vigilant beside him, processing the extraordinary day. She had entered the operating room as a surgeon and emerged with a transformed understanding of both her father and herself. The technical challenges of the procedure paled in comparison to the emotional complexity of seeing her strong, independent father rendered vulnerable, yet still maintaining his essential character through it all. Outside the recovery room window, the hospital continued its normal rhythms, staff changing shifts, patients being admitted and discharged, life and death proceeding in their eternal dance. But in this quiet room, something fundamental had shifted between father and daughter. A new respect, born from seeing each other at their most vulnerable and their most capable. Richard awoke to searing pain radiating through his face. The clock on the wall read 3:17 a.m., nearly 12 hours since his surgery. The recovery room was dimly lit, with Sarah asleep in the recliner beside the bed, her white coat draped over her like a blanket. For a moment, Richard simply watched his daughter, noting the worry lines that remained even in sleep. "Sarah," he whispered, then more urgently as the pain intensified. "Sarah!" His daughter startled awake, immediately alert in the way only medical professionals can be. "Dad, what's wrong?" "Pain," Richard managed through gritted teeth. "Bad." Sarah was on her feet instantly, checking the IV pump and Richard's vital signs. "Your next pain medication dose isn't due for another hour. I'll page the nurse." Before she could reach the call button, Richard grabbed her wrist. "Something's wrong. This isn't just surgical pain, it's moving." Sarah frowned, gently tilting her father's head to examine the bandaged areas. The remaining larvae shouldn't be causing this level of discomfort. The anti-parasitic medication should have started working. "Trust me," Richard hissed. 40 years as a doctor. I know when something isn't right." Sarah pressed the call button, then carefully peeled back one edge of the bandage near Richard's temple. What she saw made her breath catch. The skin was angry red with visible swelling that hadn't been present after surgery. "Page Dr. Winters and Dr. Campbell immediately," Sarah instructed the night nurse who appeared at the doorway, "and bring the portable ultrasound." "What is it?" Richard asked, reading the concern in his daughter's face. "Probably just post-operative inflammation," Sarah replied, though her tone lacked conviction. "We'll check to be sure." The nurse returned with the ultrasound machine, followed shortly by a sleep-rumpled Dr. Campbell. "Inflammation's increased significantly," Sarah reported, already applying gel to the ultrasound probe. "Dad's experiencing intense pain and sensation of movement." Dr. Campbell moved quickly to Richard's side, examining the visible edges of the surgical sites. "Temperature elevated?" The nurse checked. 100.4. Not alarmingly high, but concerning given the antiparasitic and antibiotic coverage. Dr. Campbell watched as Sarah positioned the ultrasound probe. "What are you seeing?" Sarah stared at the screen, her clinical expression slipping as the image became clear. "That's not possible." Dr. Campbell looked at the screen and muttered something under his breath. The remaining larvae appeared to be multiplying. What does that mean? Richard demanded, fear sharpening his voice. It means we miscalculated, Dr. Campbell said grimly. Some of these species reproduce differently than we expected. The surgical intervention may have triggered a defensive response. Sarah moved the probe to another area. This cluster definitely wasn't present during surgery. We're seeing new larval development. Dr. Winters arrived, quickly assessing the situation after viewing the ultrasound images. We need to go back in immediately. This inflammatory response will worsen rapidly. You said we needed to wait 48 hours for the second procedure, Richard reminded them, his doctor's mind still working, despite the pain. That was before we understood the reproductive acceleration we're witnessing, Dr. Campbell explained. Some tropical parasites have evolved defensive mechanisms. When threatened, they rapidly produce new generations. Richard closed his eyes briefly, absorbing this new horror. Not only were parasites living in his face, but they were now multiplying in response to attempts to remove them. Prep for immediate surgery, Dr. Winters instructed the nurse. Call in the full team. We can't wait until morning. As the room erupted into activity, Richard caught Sarah's hand. Tell me the truth. How bad is this? Sarah hesitated, clearly torn between honesty and reassurance. It's a complication we didn't anticipate, but we caught it early. That's your doctor voice, Richard observed. I want to hear my daughter's voice. Sarah's professional facade cracked. I'm scared, Dad. This is beyond my experience, beyond most people's experience. But Dr. Campbell is the best parasitologist in the country, and we're not giving up. Within 30 minutes, Richard was being wheeled back to the surgical suite, his face now burning with pain and his mind clouded with a combination of medication and mounting fever. Blood pressure 150/95, temperature 101.4, a nurse reported as they transferred him to the operating table. Dr. Winters and Dr. Campbell conversed in urgent tones as the anesthesiologist prepared for induction. Complete extraction is now the only option, Dr. Campbell insisted. We can't risk leaving any viable specimens. The tissue trauma will be significant, Dr. Winters countered, especially near the facial nerve. The alternative is worse, Dr. Campbell replied grimly. As the anesthesia began taking effect, Richard caught fragments of their continuing discussion. Potential for systemic infection if larvae rupture, may need to sacrifice some tissue function, aggressive approach necessary. Sarah appeared in his narrowing field of vision, already dressed in surgical scrubs. We're going to fix this, Dad, I promise. Richard wanted to respond, to tell his daughter not to make promises medicine couldn't always keep. But the darkness pulled him under before he could form the words. The surgical team worked with grim determination, facing a challenge far more complex than the earlier procedure. The new larvae were smaller, more numerous, and embedded in tissue already traumatized by the previous surgery. The inflammation is compressing the facial nerve, Dr. Winters noted as they accessed the first cluster. We need to relieve the pressure immediately. Dr. Campbell studied the live specimens as they were extracted. These are definitely second-generation larvae, smaller but more aggressive in their feeding patterns. Sarah worked methodically alongside the senior surgeons, her hands steady despite her emotional investment. The optical nerve pathway is showing signs of inflammation as well. Hour after hour, they extracted larvae, irrigated infected tissue, and fought to stay ahead of the parasitic invasion. Richard's vital signs fluctuated dangerously as his body struggled with both the surgical trauma and the parasitic assault. Blood pressure dropping, the anesthesiologist warned during the third hour. 90/60 and falling. Push fluids and pressors, Dr. Winters ordered without looking up from her delicate work near Richard's eye. We can't stop now. As dawn broke outside, the exhausted surgical team finally removed what they believed was the last of the larvae, 93 in total, most of them newly developed since the first surgery. Extensive debridement completed, Dr. Winters announced, stepping back from the table. All visible larvae removed and affected tissue excised. I'm concerned about microscopically viable eggs, Dr. Campbell admitted. With this reproductive pattern, we can't be certain we've eliminated all potential for recurrence. What do you suggest? Sarah asked, her voice hoarse from the hours of intense concentration. Topical antiparasitic irrigation of all surgical sites, followed by specialized antibiotic-impregnated packing. He turned to a nurse. Contact our lab immediately. Tell them we need the experimental antiparasitic compound we discussed. The post-surgical protocol was more aggressive than standard practice, reflecting the unique challenges of Richard's case. By the time they completed the final steps, morning shifts were arriving at the hospital, unaware of the night's dramatic events. Take him directly to ICU, Dr. Winters instructed as they prepared to move Richard. I want continuous monitoring for any signs of new inflammatory response. Sarah remained by her father's side during the transfer, physically and emotionally drained, yet unable to relinquish her vigil. In the harsh morning light, Richard's face was almost unrecognizable, swollen, discolored, and now covered with more extensive bandaging. "Will he—" Sarah began, then stopped, unable to articulate the question weighing on her mind. Dr. Campbell understood nonetheless. Facial nerve damage is likely given the extensive inflammation and necessary tissue debridement. Some muscle function may be permanently affected. And his vision? We won't know until he's conscious and we can assess function. We did everything possible to protect the optical nerve. In the ICU, monitors beeped steadily as Richard remained under sedation. Sarah sat beside him, still in surgical scrubs, reluctant to leave even briefly to change or eat. Dr. Lewis joined her after reviewing the surgical notes. You should get some rest, Dr. Anderson. Your father will be sedated for at least 12 more hours. I can't leave him, Sarah replied, her voice hollow with exhaustion. You've been awake for over 30 hours. You can't help him if you collapse. He rested a hand briefly on her shoulder. Get some food and a few hours of sleep. I'll personally monitor his condition. Sarah finally relented, recognizing the wisdom in his advice. Call me immediately if anything changes. Anything at all. In the doctor's lounge, she found a quiet corner and called her supervisor at the hospital, where she was completing her surgical residency. After explaining the situation in clinical terms that belied the emotional reality, she requested an extension of her emergency leave. Of course, her supervisor assured her. Family comes first. Keep us updated on your father's condition. As she ended the call, Sarah noticed several missed texts from colleagues who had somehow heard about her father's case. Word had spread through the medical community, with the details growing more sensational with each retelling. One message mentioned hundreds of tropical parasites, while another referenced flesh-eating larvae. The distortion of her father's suffering into medical gossip ignited something in Sarah, a protective fury that temporarily overcame her exhaustion. She deleted the messages without responding and headed to the cafeteria, needing fuel before confronting whatever challenges lay ahead. In the cafeteria, she overheard two residents discussing the Bugman case in hushed but excited tones. They fell silent when they noticed her, recognition dawning as they connected her to the patient being discussed. Sarah stared them down until they gathered their trays and retreated to another table. The exchange left her feeling even more protective of her father's dignity. Richard Anderson wasn't a case study or a medical curiosity. He was a respected doctor, a widower, a father who had devoted his life to helping others. After forcing down a sandwich and coffee, Sarah headed to the on-call room for a shower and brief rest. She set her alarm for 3 hours, knowing she couldn't stay away longer than that, regardless of Dr. Lewis's assurances. Sleep came instantly, but brought no peace. Her dreams filled with writhing larvae and her father's face dissolving under their assault. She woke gasping, the alarm still 20 minutes from sounding. Rather than trying to sleep again, she showered quickly and returned to the ICU. Doctor. Lewis was reviewing Richard's chart when Sarah arrived. No changes. Vital signs stable, but still showing signs of systemic inflammatory response. Sarah studied the monitors and recent lab results. White count is still elevated despite the broad-spectrum antibiotics. Dr. Campbell is consulting with tropical disease specialist regarding adjustments to the antiparasitic regimen, Dr. Lewis explained. This combination of species is extremely unusual in North America. A soft groan from the bed drew their attention. Despite the sedation, Richard was showing signs of discomfort, his hands restlessly plucking at the blanket. Pain management may need adjustment, Dr. Lewis noted. I'll speak with anesthesia about his regimen. As he left, Sarah took her father's hand, careful to avoid disturbing the IV lines. I'm here, Dad. You're in the ICU. The surgery went well. Whether Richard could hear her was uncertain, but his restless movements calmed slightly at the sound of his daughter's voice. Throughout the day, specialists came and went. Infectious disease consultants, neurologists assessing potential nerve damage, wound care experts. Each brought expertise to one aspect of Richard's complex case, but none could address the whole person suffering beneath the medical crisis. By evening, the decision was made to begin lightening Richard's sedation, allowing for neurological assessment while maintaining pain control. Sarah remained vigilant, watching for any sign that her father was emerging from the medication-induced haze. It happened gradually, a flutter of eyelids, fingers tightening around Sarah's hand, a change in breathing pattern. Then Richard's eyes opened, unfocused at first, then finding Sarah's face. Dad, can you hear me? Sarah leaned closer. Squeeze my hand if you can hear me. A faint pressure against her fingers confirmed Richard's awareness. You're in the ICU. You had a second surgery. Everything went well. Sarah kept her voice steady, professional, though her heart raced with both hope and fear. Don't try to talk yet. You have significant facial swelling. Richard blinked slowly in acknowledgement. Then his eyes widened with sudden panic, his hand moving toward his face. No, don't touch. Sarah caught his wrist gently. The bandages need to stay in place. The larvae are gone. All of them. Dr. Campbell confirmed it. Relief visibly washed over Richard, followed by a grimace of pain as he tried to move his facial muscles. Dr. Winters arrived for evening rounds, pleased to find Richard conscious. Dr. Anderson, good to see you awake. I'm going to check your bandages now. The examination was methodical but gentle. Dr. Winters carefully assessed the surgical sites, taking care not to cause additional discomfort. Swelling is significant, but not unexpected given the extensive procedure, she noted. We'll continue aggressive antibiotic and antiparasitic therapy for at least 10 more days. Richard made a questioning sound, unable to form words with his swollen face. Can he have something to write with? Sarah asked. A nurse brought a small whiteboard and marker. With trembling hands, Richard wrote, Damage? Dr. Winters didn't sugarcoat her response. There was extensive tissue involvement, particularly around the facial nerve. We won't know the full extent of functional impact until the swelling subsides, but some degree of facial asymmetry or weakness is likely. Richard wrote again. Vision. Preliminary assessment suggests the optical nerve was successfully protected, but will need formal testing when you're stronger. Dr. Winters paused. You're extremely fortunate that the second generation was caught quickly. Left untreated for even a few more hours, the outcome could have been much worse. Richard closed his eyes briefly, absorbing this information. When he opened them, he wrote, All out? Yes, Dr. Winters confirmed. Complete extraction confirmed. The anti-parasitic regimen is precautionary to ensure any microscopic remnants are eliminated. After Dr. Winters left, Richard turned his attention back to Sarah, writing with effort. "You look terrible." Sarah laughed despite herself. "Thanks, Dad. You don't look so great yourself." Richard's eyes crinkled slightly, the closest he could manage to a smile with his bandaged face. He wrote again. How bad was it really? Sarah hesitated, weighing honesty against mercy. It was challenging. The second-generation larvae had infiltrated tissue already traumatized from the first surgery, but we got them all. Richard seemed to accept this abbreviated version, his energy visibly fading. He managed one more question on the whiteboard before exhaustion claimed him. "Hospital gossip?" Sarah sighed. "Pretty much what you'd expect. You're the most interesting case they've seen in years." Richard's eyes conveyed a mix of resignation and humor before drifting closed, the medication and exhaustion pulling him back into sleep. Left alone with her thoughts, Sarah contemplated the journey ahead. The immediate crisis had passed, but recovery would be long and uncertain. Beyond the physical healing lay the psychological impact. How would her fiercely independent father cope with potential disfigurement or functional limitations? How would the man who had prided himself on his competence adapt to being the subject of medical fascination and pity? Outside the ICU window, evening settled over the hospital campus. Sarah watched the lights coming on in patients' rooms across the courtyard, each window representing someone's personal medical crisis. Her father's case might be unusually dramatic, but every patient faced their own battle between vulnerability and dignity, between the clinical reality of their condition and their identity beyond their illness. The nurse returned to check Richard's vital signs, working quietly to avoid disturbing his sleep. "His temperature's down to 99.2, she noted with satisfaction. "Looks like we might be turning a corner." Sarah nodded, clinging to this small positive sign. "Has Dr. Campbell mentioned when he'll return?" "He said he'd be back after he reviews the lab results on the extracted specimens." The nurse adjusted Richard's blanket with gentle hands. "Your father must be quite a man. Even sedated, he has this presence." "You can tell he was one of us." "He was the best," Sarah said softly. "Then, is the best?" She corrected herself, refusing to speak of her father in the past tense, despite the transformative nature of what had happened. As night fell fully, Sarah maintained her vigil, watching the steady rise and fall of her father's chest, the rhythmic beeping of monitors providing a technological lullaby. The worst had happened, and then something even worse. Yet Richard had survived. The road ahead would be difficult, but they had made it through the darkest hours. Sarah rested her head briefly on the edge of the bed, exhaustion finally claiming her. Her last conscious thought was a promise to herself and to her father. Whatever came next, they would face it together. 3 days after the second surgery, Richard was moved from the ICU to a private room on the surgical floor. The critical danger had passed, but the journey toward recovery was only beginning. As Sarah helped settle her father in the new room, she noticed his gaze lingering on every reflective surface, yet never quite looking directly at his own image. "The swelling will continue to decrease," Sarah assured him, arranging pillows to support Richard's head at the optimal angle. "Dr. Winters is pleased with how the surgical sites are healing." Richard nodded slightly, wincing at even this small movement. His ability to speak had improved marginally, though his words came out slurred and effortful through partially immobilized facial muscles. "Mirror," he requested, his first verbal demand since regaining consciousness. Sarah hesitated. "Dad, it might be better to wait until more of the swelling." "Mirror," Richard repeated more forcefully. With reluctance, Sarah retrieved a small hand mirror from the bathroom. "Remember, what you're seeing now is temporary. The inflammation will continue to resolve over the coming weeks." Richard took the mirror with a trembling hand, steeling himself before raising it to view his reflection. Sarah watched her father's eyes widen, then fill with tears as he confronted his transformed appearance. The right side of Richard's face remained significantly swollen, with visible suture lines tracking across his cheek and temple. More concerning was the noticeable drooping at the corner of his mouth and eye, evidence of the facial nerve damage Dr. Winters had warned about. After a long moment, Richard lowered the mirror to his lap. "Well," he said, his voice barely above a whisper, "I won't be winning any beauty contests." The attempt at humor didn't mask the shock and grief in his eyes. Sarah sat on the edge of the bed, taking her father's hand. "The nerve function may still recover," she offered. "It's too early to know the permanent extent." Richard nodded absently, his gaze now fixed on the window. "Did they get all the specimens they needed for their research?" "Dr. Campbell has everything he needs. He's been coordinating with the CDC's parasitology lab." "Good." Richard seemed to find some comfort in the idea that his suffering might serve a scientific purpose. Someone should benefit from this nightmare. A knock at the door interrupted them. Mr. Bradford entered, carrying a small arrangement of flowers that seemed more obligatory than thoughtful. "Dr. Anderson, it's good to see you transferred to the floor. A positive step in your recovery." His smile was professional, but his eyes betrayed discomfort as they flicked over Richard's bandaged face. "I wanted to check in personally and see if there's anything the hospital can do to make you more comfortable." "You could start by telling your staff to stop treating me like a sideshow attraction," Richard replied, his words slow but pointed. "The nursing assistant who brought my breakfast nearly dropped the tray when she saw my face, and I've counted 4 different accidental room entries from staff who have no business with my care." Bradford's smile tightened. "I apologize for any discomfort. Rest assured, I'll address this immediately." He paused, clearly transitioning to the actual purpose of his visit. "On another matter, our public relations department has been fielding increasing media inquiries about your case. Nothing identifying you specifically, but the medical community is quite interested in this rare parasitic presentation." Sarah straightened, instantly protective. "My father is still in the acute recovery phase." "This isn't the time to discuss media." Of course," Bradford backpedaled smoothly. "I merely wanted to inform Dr. Anderson that when, and only when, he feels ready, the hospital would be prepared to manage any approved information sharing in a way that respects his privacy while contributing to medical knowledge." Richard studied Bradford with the shrewd assessment of a veteran doctor. "What you mean is you'd rather control the narrative than have it leak out piecemeal through hospital gossip." Bradford didn't deny it. "We believe a structured approach benefits everyone." "I'll think about it," Richard conceded, "after I've had time to process what's happened to me. For now, I'd appreciate privacy and professional treatment from your staff." After Bradford departed, Richard sighed heavily. Some things never change. Administration always more concerned with optics than patients. "You don't have to make any decisions about sharing your case," Sarah assured him. "Your only job right now is recovery." "And what about your job?" Richard asked, fixing his daughter with a penetrating look despite his weakened state. "You've been here almost a week." "My residency is on hold," Sarah finished firmly. "I've arranged an emergency family leave. You can't put your career on pause for me." "Watch me," Sarah replied with a hint of the stubbornness she'd inherited from her father. "Besides, it's not entirely altruistic. The surgical experience I gained has been educational." Richard attempted a smile that pulled unevenly at his damaged facial muscles. "Always finding the silver lining, just like your mother." The mention of Margaret, rare since her death, hung in the air between them, a bittersweet reminder of absence amid their current crisis. "She would have been proud of you," Richard added softly. "I am too." Sarah swallowed against unexpected emotion. I learned from the best. Their moment was interrupted by Dr. Campbell's arrival. The CDC parasitologist carried a tablet and wore an expression that immediately put Sarah on alert. "Dr. Anderson, how are you feeling today?" he asked, his tone professionally warm. "Like I've been through a war," Richard replied. "But I'm told I'm winning." "Indeed you are. Your recovery is progressing well, given the circumstances." He glanced at the monitor displaying Richard's vital signs. "I've come to discuss our findings from the extracted specimens. There are some unusual aspects I thought you should be aware of." Sarah moved closer to her father's side. "What kind of unusual aspects?" Dr. Campbell swiped through several images on his tablet. "We've identified 3 distinct parasitic species in your samples, Dr. Anderson. 2 are variants of Dermatobia hominis, the human botfly, which we expected given your Florida exposure." "And the third?" Richard prompted when he hesitated. "The third is extremely rare in North America. It's a species called Cordylobia anthropophaga, commonly known as the tumbu fly. It's native to sub-Saharan Africa and almost never seen in the United States." Richard and Sarah exchanged confused glances. "I've never been to Africa," Richard stated. "Exactly why this is significant," Dr. Campbell continued. "The presence of this species suggests you encountered someone or something that had recently been in an endemic region." "Is this relevant to my father's treatment?" Sarah asked, cutting to the practical concern. "Potentially. The tumbu fly larvae were responsible for the reproductive acceleration we witnessed after the first surgery. This species has evolved particularly aggressive defensive mechanisms when threatened." Richard processed this information with the clinical detachment he'd cultivated through decades of medicine. "So I was exceptionally unlucky. Not only did I get infected with parasites, but I somehow encountered an African species in Florida." "More than unlucky," Dr. Campbell clarified. "This represents a potential public health concern. If these non-native parasites are establishing in Florida, other cases could emerge. And this is why the hospital is so interested in my case," Richard concluded. "Not just medical curiosity, but public health implications." "Precisely. The CDC would like to conduct a detailed investigation of your exposure history in Florida. Any information could help identify potential vectors." Richard nodded slowly. "I'll cooperate, of course, but I need time to recover first." After Dr. Campbell left, promising to return the following day with a detailed questionnaire, Richard fell into thoughtful silence. Sarah recognized the expression. Her father was mentally reviewing his Florida trip, searching for the moment of exposure with the analytical precision of a medical professional. "The bird sanctuary," Richard said suddenly. "There was a volunteer there leading a tour. He mentioned just returning from a research trip to Tanzania. I spoke with him for quite a while about native bird species." Sarah made a note to share this information with Dr. Campbell. That could be the connection, if he brought back clothing or equipment that carried the flies or eggs. "Mystery solved," Richard murmured, though the solution brought little comfort. The knowledge of how he'd been infected didn't change the reality of what had happened to his body and what still lay ahead. Throughout the afternoon, a steady stream of medical personnel visited. Physical therapists assessing facial muscle function, wound care specialists changing dressings, neurologists testing nerve responses. Each interaction reinforced Richard's new reality as a patient rather than a provider, his medical knowledge both a blessing and a curse, as he understood every clinical implication discussed in hushed tones. By evening, exhaustion had settled over him like a heavy blanket. Sarah adjusted the room lighting and prepared to leave for the night, having finally been convinced to sleep in a proper bed at the nearby hotel. "You'll call if anything changes," she confirmed with the night nurse. "Immediately," the nurse promised. "But he's stable now. You need rest too, Dr. Anderson." As Sarah gathered her things, Richard motioned her closer. "I had a dream in the ICU," Richard confessed, his voice thick with emotion and medication. "I dreamt Margaret was sitting with me, holding my hand just like you've been doing. She told me it wasn't my time yet, that I needed to stay for you." Sarah felt her throat tighten. Mom always did have good advice. "I feel so changed," Richard continued, gesturing vaguely toward his face. "Not just physically. Something fundamental shifted when I realized what was happening to me. All those years as a doctor, I thought I understood what patients experienced. I didn't know anything. You were a good doctor, Dad. I was an efficient doctor. There's a difference." Richard's undamaged eye glistened with tears. "I remember that patient years ago. Homeless man, terrible wound infection with maggots. The staff treated him like he was disgusting, something less than human. I provided proper care, but did I ever really see him? Did I recognize his fear, his shame at being a spectacle? Now I know exactly how he felt." Sarah had no answer for this raw confession. Instead, she squeezed her father's hand, offering presence when words failed. "Get some rest," she said finally. "I'll be back first thing tomorrow." At the hotel, Sarah collapsed onto the bed, fully clothed, the accumulated exhaustion of the past week finally claiming its due. Her phone buzzed with a message from Dr. Winters, a reminder about Richard's follow-up imaging scheduled for the morning, but she lacked the energy to respond immediately. As sleep pulled at her consciousness, Sarah's mind drifted to the Boston fellowship she'd been pursuing before her father's crisis. The prestigious position at Boston General's Tropical Medicine Unit had been her career focus for months. Now, the thought of leaving Richard to recover alone seemed impossible. Morning arrived too quickly, sunlight streaming through curtains she'd forgotten to close. Sarah showered quickly and headed back to the hospital, stopping at the cafeteria for coffee strong enough to cut through her lingering fatigue. As she approached Richard's room, raised voices from inside gave her pause. A completely inappropriate questioning. That was Richard, his compromised speech still carrying the authority he'd wielded as a senior doctor. "Dr. Anderson, we're simply trying to understand," a male voice Sarah didn't recognize. "You're trying to shift liability. Don't think I don't recognize a legal fishing expedition when I see one." Sarah pushed open the door to find Richard propped up in bed, facing a man in a suit who stood awkwardly by the window. A woman beside him was taking notes on a tablet. "What's going on here?" Sarah demanded. The man turned, extending a hand she didn't take. "Kevin Bradshaw, Hospital Legal Counsel. We're conducting a standard exposure assessment for Dr. Anderson's case. Without his physician present or family." Sarah moved to her father's side, noting the heightened color in Richard's undamaged cheek, a sign of agitation. "My father is recovering from major surgery and is on significant medication. Any questioning should be scheduled through his care team." Bradshaw retreated slightly under Sarah's professional glare. "Of course, Dr. Anderson. We'll reschedule at a more appropriate time." After they departed, Richard sank back against his pillows. Vultures. They kept asking if I ignored posted warnings or ventured into restricted areas in Florida, trying to establish that I behaved negligently to protect the hospital from any potential claim. "Did you tell them to go to hell?" Sarah asked, checking her father's pulse, elevated, as expected after the confrontation. "In more professional terms, but essentially yes." A shadow of Richard's former spirit flickered across his damaged features. "I may be down, but I'm not out." Sarah smiled, recognizing the resilience that had carried her father through widowhood and would now see him through this recovery. "Dr. Winters will be here soon for your imaging." "Let's get you ready." The morning proceeded with the structured rhythm of hospital routine. Medication rounds, physical therapy, the promised imaging to assess healing and nerve function. Richard endured each procedure with stoic determination, though Sarah noticed his increasing withdrawal with each new interaction. When they were finally alone again, Richard turned to Sarah with unexpected vulnerability. "I can't stay here much longer. The way everyone looks at me, with curiosity or pity or disgust, it's wearing me down. Dr. Winters mentioned possible discharge in another few days if your labs continue improving," Sarah offered. "And then what? I go home alone to a house with stairs I can barely navigate and no one to help with dressing changes?" Richard gestured to his face. "I hate admitting this, but I can't manage on my own yet." Sarah had anticipated this conversation. "You could stay with me. My apartment has an elevator, and I'm close to the hospital for follow-ups." "And your residency?" "I won't derail your career, Sarah." "It wouldn't be derailing. I can arrange a temporary assignment at my hospital. They've already offered it, given the unique circumstances." Sarah hesitated. "Or there's another option. Boston General has one of the best facial reconstruction programs in the country, alongside the tropical medicine unit where I was applying for fellowship. We could transfer your care there, and I could accept the fellowship position. 2 birds, 1 stone." Richard studied his daughter, medical professional to medical professional. "You're proposing uprooting both our lives based on this crisis." "I'm proposing making the best of a difficult situation," Sarah countered, "getting you the best reconstructive care available while allowing me to continue my career progression." Before Richard could respond, Dr. Winters arrived with the imaging results. Her expression was guardedly optimistic as she displayed the scans on a tablet. "The good news is we're seeing no evidence of residual parasitic presence. The anti-parasitic therapy has been successful." She swiped to another image. "The concerning news is the extent of facial nerve damage. As you can see here, there's significant compromise to the mandibular branch." Richard absorbed this with clinical detachment. "Prognosis for recovery?" "Partial recovery is likely with aggressive physical therapy. Complete recovery, less certain." Dr. Winters hesitated. "Given the extent of tissue damage, reconstructive procedures will likely be necessary for both functional and cosmetic improvement." "In other words, my face will never be the same," Richard stated flatly. "Medicine advances every day," Dr. Winters reminded him gently. "I've taken the liberty of consulting with several reconstructive specialists. Dr. Margaret Chen at Boston General is particularly interested in your case." Richard's gaze flicked to Sarah, a silent acknowledgement passing between them. "Boston General," Richard repeated, "where my daughter has been offered a fellowship." Dr. Winters smiled. "Sometimes the universe aligns, even in difficult circumstances. Dr. Chen is pioneering microsurgical techniques for facial nerve reconstruction. Your case presents unique challenges that could benefit from her expertise." After Dr. Winters left, Richard and Sarah sat in contemplative silence. The rhythm of the hospital continued around them, call buttons chiming, staff chatting at the nurse's station, the squeak of cartwheels in the hallway. Within their room, however, a pivotal decision hung in the air. "Boston," Richard finally said. "It makes sense medically." "But," Sarah prompted, hearing the hesitation, "but it means leaving the home I shared with your mother." "The life I built here." Richard touched his damaged face gently. "Though perhaps that life is already gone, transformed as surely as my appearance." "Home isn't just a place, Dad. Mom used to say that all the time." Richard smiled lopsidedly at the memory. "She did, didn't she? Home is where you feel like yourself," she'd say. His smile faded as he gestured toward his reflection in the window glass. "The question is, who am I now? Will I ever feel like myself again anywhere?" Sarah had no easy answer for this existential question that cut to the heart of identity and self-perception. Instead, she offered the only truth she knew with certainty. Wherever you go from here, you won't go alone. Richard reached for his daughter's hand, gripping it with surprising strength. "When did you become so wise?" "I had good teachers," Sarah replied, returning the squeeze. "So, Boston," Richard nodded, decision made. "But not because I need to be taken care of. Because it's the right medical choice, and because—" He paused, gathering courage for an admission that didn't come easily to his independent nature. "Because I'm not ready to face this alone." The admission cost him. Sarah could see this proud man acknowledging vulnerability after a lifetime of self-reliance. But in that acknowledgement lay the seed of a new relationship between them, one built on mutual respect rather than the father-daughter dynamics that had often generated friction. "I'll start making arrangements," Sarah said, already mentally listing the necessary steps: medical transfers, housing, her fellowship acceptance. "There's one more thing," Richard added. "Bradford and his PR concerns. Before we leave, I want to meet with the CDC team. If sharing my case can prevent someone else from going through this, I want to do it on my terms." "Are you sure?" "You don't owe them anything. I owe it to myself," Richard corrected, "to give this nightmare some meaning beyond personal tragedy. Isn't that what we both went into medicine for? To make suffering count for something?" Sarah recognized the doctor in her father reasserting itself. The professional dedication that had defined Richard's life now helping him make sense of his own trauma. It was a healthy sign, this reaching beyond personal pain toward purpose. "I'll let Dr. Campbell know," she agreed, "but only when you're ready, and only what you're comfortable sharing." As evening approached, Richard dozed fitfully, while Sarah began researching Boston apartments that could accommodate her father's recovery needs. The path ahead remained daunting: reconstructive surgeries, physical therapy, adaptation to new limitations. But for the first time since the crisis began, Sarah felt a cautious optimism. Whatever came next, they would face it together, their relationship transformed by fire just as surely as Richard's face had been. From the chrysalis of this medical nightmare, something new was emerging, not just a changed appearance, but a changed understanding between father and daughter, between caregiver and cared for, between the people they had been and the people they were becoming. 3 months later, autumn painted Boston Common in fiery oranges and reds, visible from the window of Richard's physical therapy room at Boston General. He sat before a mirror, methodically working through exercises designed to strengthen the partially regenerated facial nerves. "Good, Dr. Anderson. Now try to raise the right corner of your mouth again," instructed Diane Levinson, the facial rehabilitation specialist who had been working with Richard since their arrival in Boston. Richard focused intently, the effort visible in his furrowed brow as he attempted to create a symmetrical smile. The right side of his face responded weakly, lifting perhaps half as much as the left side. "That's improvement," Diane encouraged. "Definite improvement from last week." "Still looks like I've had a stroke," Richard observed, matter-of-factly, studying his reflection without flinching, a hard-won ability after weeks of avoiding mirrors. "The nerve regeneration is progressing faster than we initially projected," Diane countered, making notes in Richard's file. "Dr. Chen will be pleased to see this progress before your next procedure." Richard nodded, accepting the professional assessment while maintaining his own clear-eyed view of his condition. The past 3 months had taught him to balance hope with realism, to work tirelessly toward recovery, while acknowledging that some changes might be permanent. After completing the therapy session, Richard gathered his things and made his way to the hospital cafeteria, where Sarah would meet him for lunch between surgical cases. Their new routine in Boston had quickly solidified. Sarah immersed in her fellowship at the tropical medicine unit. Richard dividing his time between medical appointments and slowly building a new life in this unfamiliar city. The cafeteria buzzed with the familiar energy of a teaching hospital. Residents huddled over coffee discussing cases. Nurses grabbing quick meals between shifts. Families of patients finding momentary respite from bedside vigils. Richard selected a salad and soup, navigating the space with the confidence he'd gradually reclaimed after initially feeling self-conscious about his appearance in public. "Dad," Sarah waved from a corner table, still wearing surgical scrubs under her white coat. "How was PT?" "Diane says I'm making progress," Richard replied, settling into the chair across from his daughter. "Though my face still thinks it's auditioning for the Phantom of the Opera." Sarah smiled at her father's dark humor, a coping mechanism that had emerged during recovery. "The neural regeneration takes time. You're only 3 months out from massive trauma." "Says the doctor who wasn't happy when she couldn't run a 5K 2 weeks after having her appendix out," Richard countered, his lopsided smile softening the critique. They fell into comfortable conversation about Sarah's current cases and Richard's morning therapy session. The easy rapport between them represented perhaps the most unexpected outcome of the ordeal, a relationship transformed from occasional tension to genuine friendship. "Dr. Chen wants to schedule the second reconstructive procedure for next month," Richard mentioned between spoonfuls of soup. "She's pleased with how the first one healed." "That's earlier than expected. You feel ready?" Richard considered the question seriously. The first procedure had addressed the most severely damaged tissue near his eye, successfully restoring his ability to close his eyelid completely, a functional necessity that had also improved his appearance. The second would focus on the corner of his mouth and cheek, where nerve damage had left him with asymmetrical facial expressions and occasional drooling when he drank liquids. "Ready as I'll ever be," he decided, "though I'd appreciate you being there if your schedule allows." "I'll make it allow," Sarah promised immediately. "Wild horses couldn't keep me away." Richard smiled at the familiar phrase, one of Margaret's favorites that Sarah had unconsciously adopted. These small echoes of his late wife brought comfort rather than pain now, a shift Richard recognized as healing of a different sort. Their lunch was interrupted by Sarah's pager. She checked it with a frown. "I need to get back. One of my research patients is showing complications." "Go," Richard urged. "I'm heading home anyway. Martha's coming over to help me sort through those boxes that finally arrived from Florida." Sarah hesitated. "You sure you're okay getting home alone?" "I managed an emergency room full of crises for 40 years. I think I can handle the tea," Richard replied dryly. "Besides, I've been doing it for weeks now." "Old habits," Sarah apologized, gathering her things. "Sometimes I still see you as you were in that hospital bed. And sometimes I still expect to see my old face in the mirror," Richard acknowledged. "We're both adjusting." After Sarah hurried away, Richard finished his lunch alone, observing the humanity around him with the heightened awareness his experience had fostered. He noticed a young resident at a nearby table stealing glances at his scarred face, curiosity poorly disguised as casual observation. Once such scrutiny would have sent him retreating behind a protective shell. Today he met the young doctor's gaze directly until he looked away, embarrassed at being caught. Small victories, Richard thought, as he disposed of his tray and headed toward the hospital exit. The journey back to their shared apartment was now familiar. A subway ride followed by a short walk through a neighborhood that was slowly becoming home. Richard had initially resisted the idea of living with Sarah, fearing it would strain their newly strengthened relationship, but practicality had won out. The 2-bedroom apartment near the hospital provided Richard the support he needed while maintaining separate spaces that honored their independent lives. Martha Reynolds, a retired nurse who lived in the same building and had befriended Richard shortly after their arrival, was waiting at the apartment door with coffee and determined cheerfulness. "Ready to tackle those boxes?" she asked, following Richard inside. "I brought reinforcements." She held up a bottle of wine. "For after, of course." "You're a saint," Richard declared, hanging up his coat. though I'm not sure anything short of a hazmat team is adequate for this job. The boxes in question had finally arrived from Richard's Florida home, the last of his possessions he'd decided to keep after making the difficult decision to sell the house. Most of his furniture and household items had gone to charity or storage, but these boxes contained the personal artifacts he couldn't bear to part with. Margaret's things, family photographs, the treasured mementos of a life now transformed. As they worked through the afternoon, sorting items into keep, donate, and trash piles, Richard found himself sharing stories prompted by each discovered treasure. Margaret's collection of birdwatching journals, the champagne cork from their 25th anniversary, Sarah's childhood artwork carefully preserved. "You two have come a long way," Martha observed as Richard showed her a particularly dreadful clay sculpture Sarah had made in second grade. "When you first moved in, there was still some tension there." Richard nodded, carefully rewrapping the sculpture. Nothing like a face full of parasites to reset a relationship. Martha, familiar with Richard's story, didn't flinch at the blunt reference. "Silver linings come in strange packages sometimes." "The strangest," Richard agreed, opening another box labeled Margaret's Study. Inside lay his wife's books, her reading glasses, the small wooden box where she'd kept ticket stubs from every concert and movie they'd attended together. The familiar objects brought her presence into the room so vividly that Richard had to pause, overwhelmed by memory. Martha tactfully busied herself with another box, giving Richard space to process the emotion. After a moment, Richard continued unpacking, handling each item with reverent care. "Margaret would have handled this whole ordeal better than I did," he reflected. "She always found humor in the darkest situations." "Seems to me you found your own way through," Martha countered. "Not many people could face what you did with such dignity." Richard laughed softly. "Dignity?" "I spent weeks alternating between terror and self-pity. And yet here you are, rebuilding your life, helping others by sharing your story." Martha gestured toward the coffee table where advance copies of the CDC's medical bulletin lay open to an article about Richard's case. The educational piece, published with his cooperation, detailed the unusual parasitic infection and provided guidance for medical professionals on recognition and treatment. "That was Sarah's influence," Richard admitted. "She convinced me that hiding away wouldn't serve anyone, least of all myself." The afternoon passed quickly as they worked through the boxes, Richard gradually separating his past from his present, deciding what would find a place in his new life and what needed to remain in memory only. By early evening, the apartment had transformed. Photographs of Margaret and Sarah now graced the walls. Familiar books filled previously empty shelves, and small treasured objects brought warmth to the modern space. "Much better," Martha approved, surveying their work. "Now it looks like someone actually lives here." They were sharing the promised wine when Sarah returned, looking tired but satisfied after her day at the hospital. "Wow," she exclaimed, taking in the transformed apartment. "It actually looks like home now." "That was the idea," Richard replied, "though I may have gone overboard with your mother's books." Sarah crossed to the newly filled bookshelf, running her fingers over the familiar spines of Margaret's bird guides and medical texts. "No, it's perfect. She belongs here, too." Martha tactfully made her exit, promising to check in the next day. After she left, Sarah collapsed onto the sofa beside her father, kicking off her shoes with a sigh of relief. "Rough day?" Richard asked. "Challenging. We admitted a patient with a parasitic infection that mimics some aspects of your case, though nowhere near as severe," Sarah explained. "The team actually referenced your CDC bulletin during our differential diagnosis." Richard felt a complex surge of emotion. Pride that his suffering had already helped another patient. Sadness that someone else was experiencing even a fraction of what he had endured. "Will they recover?" Fully, we expect. We caught it much earlier, thanks to increased awareness. Sarah turned to study her father's face in the evening light. How about you? How was it? Going through Mom's things. Harder than I expected. Easier than I feared. Richard gestured around the apartment. But necessary. This place needed to become home, not just somewhere I'm staying temporarily. Sarah nodded, understanding the significance of this acceptance. For weeks after their move, Richard had referred to the apartment as your place, maintaining the fiction that his stay was provisional. Today's unpacking represented a commitment to their shared future in Boston. By the way, Sarah mentioned, reaching for her bag, Dr. Chen asked me to give you this. She handed Richard a folder containing preoperative information for the upcoming procedure. She's incorporating some new microsurgical techniques that have shown promising results for nerve regeneration. Richard reviewed the materials with his doctor's eye for detail. Innovative approach, higher risk but potentially better functional outcome. That's her assessment too. The decision is yours, of course. Richard closed the folder, decision already made. I didn't come this far to take the conservative route now. Sarah smiled at her father's characteristic determination. I had a feeling you'd say that. They ordered dinner in, neither having the energy to cook after their respective demanding days. As they ate Chinese food directly from cartons, a casual informality that would have been unthinkable in their previous relationship, Richard found himself studying his daughter's face, seeing both Margaret and himself reflected there along with something uniquely Sarah's own. I'm proud of you, Richard said suddenly. Not just for how you've handled all this, but for the doctor you've become, the person you are. Sarah looked up, startled by the unexpected praise. Where did that come from? Unpacking memories all day, I suppose. Richard set down his carton. I was thinking about how your mother would see you now, how proud she would be of your compassion as well as your skill. I learned from both of you, Sarah replied, emotion thickening her voice. Mom taught me empathy. You taught me strength. And here I thought I mostly taught you stubbornness, Richard quipped, lightening the moment before it became too heavy with sentiment. Sarah laughed, accepting the shift. That too, in spades. Later, after Sarah had retreated to her room to review patient files, Richard stood before the bathroom mirror, performing his evening facial exercises without the self-consciousness that had initially made them so difficult. He studied his reflection critically but not unkindly, noting the asymmetry that remained, but also acknowledging the significant healing that had occurred. The face looking back at him was not the one he had worn for 60 years. It told a new story now, one of survival, of unexpected crisis, of rebuilding. Each scar and imperfection represented not just trauma, but resilience. This was the face that had emerged from an unimaginable ordeal, forever changed, but still unmistakably his. Good enough, he told his reflection with the pragmatism that had carried him through medical school, widowhood, and now this life-altering medical crisis. In his bedroom, Richard found himself drawn to the photograph of Margaret he'd placed on his nightstand, one taken on their last anniversary before her diagnosis, both of them laughing at some forgotten joke, unaware of what lay ahead. You wouldn't recognize me now, he murmured to the image, but I think you'd recognize who I've become. Sleep came easier these days, no longer disrupted by phantom sensations of movement beneath his skin or nightmares of invasive creatures. Tonight, Richard drifted off with a sense of quiet accomplishment. Boxes unpacked, memories honored, future embraced. Tomorrow would bring its challenges, another doctor's appointment, more physical therapy, continued adaptation to his new reality. But tonight, in an apartment now filled with tangible connections to his past, and growing evidence of his present. Richard Anderson rested in the knowledge that he had survived not just physically but essentially. The parasites had changed his face but failed to alter his core. The doctor, the father, the widower, the fighter who had emerged from crisis with a deeper understanding of both vulnerability and strength. In the quiet apartment, as Boston's autumn night settled around them, father and daughter slept under the same roof, no longer caregiver and patient but partners in the continuing journey of recovery and rediscovery. The worst was behind them. The future, with all its uncertainties and possibilities, awaited. Sometimes life's greatest challenges become our most unexpected turning points. Richard's harrowing journey from hospital emergency to healing, from having parasites beneath his skin to finding renewed purpose, reminds us that even our darkest moments can lead to profound transformation. Like Richard, many of us face unexpected health crises that change not just our bodies, but our relationships and sense of self. Yet through his ordeal, he discovered what truly matters. The daughter who became his partner in healing, the strength he never knew he possessed, and the wisdom to find meaning in suffering. Richard's story teaches us that aging doesn't diminish our capacity for reinvention. When he unpacked those boxes in his new Boston apartment, placing Margaret's books on shelves and hanging family photos, he wasn't just decorating. He was declaring that life continues differently but meaningfully. As Dr. Richard Anderson once told his patients and now knows firsthand, it's not what happens to you that defines you. It's how you face it that matters. Richard's journey reminds us that it's never too late to reinvent ourselves. At 60, he faced a crisis that transformed not just his appearance but his entire perspective on life. Like many of us in our golden years, he discovered that our true strength emerges not from avoiding vulnerability, but from embracing it. After decades as the doctor who treated patients, becoming the patient himself taught Richard what medicine couldn't: that human connection is the most powerful healing force we possess. His story speaks to all of us who worry about dependency or illness as we age. Rather than diminishing him, Richard's ordeal ultimately enriched his relationship with his daughter and deepened his appreciation for life's precious moments. The face that now greets him in the mirror tells a new story, one of survival, resilience, and newfound wisdom. What unexpected challenge has transformed your life in ways you now see as valuable? Has a health crisis ever brought you closer to a loved one you had drifted from? Share your story of resilience in the comments below. Remember, as Richard learned, it's not what happens to you that defines you. It's how you face it that matters.